Hello everyone, my name is Alex and welcome to today's OET mock speaking class. I look forward to speaking to some of you today in regards to doing some mock speaking practice. This is an opportunity for you to use your skills that you have acquired so far within the context of your OET speaking preparation, and I'll be providing some feedback in order to advise you on areas of strength and areas where we can move forward and make improvements as you progress towards your exam. So a very warm welcome to each of you today. Let's see who is joining us in the class. Please let me know if you are watching live in the chat box where you are watching from and your name as well. And also, please let me know when you are planning on doing your OET exam. If you've got your exam coming up very soon, then getting involved in some mock speaking practice is definitely something that would be recommended and of value. So we've got Sanskruti, who is watching us live on Facebook. Hello to you, Sanskruti. And Namika as well, who is watching on YouTube. So hello to you, Namika. I can see also that Mihaela is watching on YouTube. So hello to you. And hello to Alexi, Niha, Yashaswini, and Treasure. Hello to all of you watching on YouTube. Hello to Srinath, who is from India, and Sajita as well. Yashaswini is watching from India. Fazal from Kuwait. And we've got Jocelyn from the Philippines. Great to see you all watching today. Got a number of other students joining us. Itrat is watching, as is Neha. Sarania. Ria is watching from the UK. I'm in the UK as well. And we have Rida. Mihaela is watching from Romania. Salman from Pakistan. And we have Srinat and Sinu. Adam, Alexi from Dubai. Alexi hasn't decided when he's doing the exam yet. Tamana is watching. Oh, thank you, Tamana. Says your classes are really good. Thank you for that. Nadaje is watching from Zimbabwe. Dan from the Philippines. Rajeshwari, Sirat, Hosifa, Lloydie, Pramod, Shailet. Shailet is in Zimbabwe. Hosifa in Saudi Arabia. Rida watching from Pakistan. And Lloydie is watching from the Philippines. Srinath says he's planning on taking the exam next month. Best of luck with that, Srinath. Millicent from the UK. And Eram is watching from Saudi Arabia. So great to see so many people who are watching live at the moment. And I can also see that we've been joined by a number of people watching on Facebook as well. Joyce, Sanskruti, Rads, Jinson, and Frankie have all joined us, as has Anila, Amira, who is in the UK. Anila is in Kerala, and Ja has joined us as well as Siju, who is watching from the UAE. Okay, so great to see you guys with us. We've got Steiner, who is a nurse watching from Kerala, who has their exam on October the 9th. So coming up fairly soon in that case. Okay, so a very warm welcome to all of you who are watching live at the moment. As I say, this will be an opportunity to do some speaking practice and to make some improvements, but also it's an opportunity just to go through the different elements of the exam, the speaking exam, and to provide some guidance and some pointers in terms of how to perform at the highest level. So let's have a look at the aims for today's lesson. So what we will be focusing on today is to learn, and for those who are already somewhat familiar, to review the scoring criteria for OET speaking. There will be an opportunity as well to take part or listen to OET role plays, and also to listen to feedback on student performance. And I also encourage you to give your own feedback in the comments as well, based on areas of strength and areas which could be improved from those who do the OET speaking practice. There will then be a final opportunity at the end of the class for some Q&A. So, to let you know, we are currently offering 20% off selected OET courses. If you are looking at taking your exam soon, then this is an opportunity to take advantage. And if you are new to OET and haven't booked your exam yet, then also this is information which will be useful to you. So be aware that the 20% off ends today. You only have until today to take advantage of this offer. So what do you plan to do when you pass your OET? What are your goals once you have that qualification, once you are fully able to demonstrate your English knowledge? What are your plans going forward in relation to the OET? Let me know in the chat box what you plan on doing, what your goals are. We've got Devine that's just joined us. Good morning. Good morning to you, Devine. Are you in the UK as well, where it is morning time? So yeah, so let me know in the comments. What are you planning on doing once you have passed your exam? So Plaxides says to relocate and work in the UK as a nurse. Okay, very nice. Sanskruti says I will go with the PLAB. Okay. Vaidehi is watching from New Zealand. Hello to you. Almon wants to relocate to the UK and continue their profession as a nurse. So that is a common goal, isn't it? Once we pass the OET, yeah, Melagrito is also expressing the same plan to proceed with her application to the UK as a nurse. Jeren to enhance his career, and Shadi wants to be registered in Ireland. So the goal is to move abroad, isn't it? To move forward with the career. That's what obviously passing the OET will allow. Mana, morning to you, Mana. The plan is to apply to the GMC or apply for GMC registration. Vima wants to go to the work in the NHS in the UK. Josefa wants to be a researcher, and Charlotte wants to find an opportunity to work in Europe. So, yeah, so a lot of desires here to move to the UK. Michaela, and yeah, Salman wishes to go to the NHS as well. So yeah, a number of people desiring to move forward in terms of their careers and to relocate to English-speaking countries, particularly the UK, a few in Ireland as well. Okay. What is your biggest challenge with OET speaking? So I can see here we've got a question from Tamana. Alex, can you please say, can we summarize in between and after finishing the role play? So it depends on the role play, Tamana. If you have to give a lot of instructions or a lot of information, it's always a good idea to summarize once you've provided that information to ensure that the patient understands. So you can do this possibly in the middle of the role play or at the end of the role play. Okay, so obviously we'll have a look at 2 role plays today, and we'll look at 2 contexts, and we can look at how we could summarize effectively within these contexts. As a general rule, summarizing at the end is a good idea because it highlights key points and ensures that the patient has the call to action that they need. But yes, summarizing definitely is an important element. So fluency, says Plaxides, Shadin, and also outstanding Nurses Hub. Fluency causes an issue. Sanjay, empathy, yeah, providing sentences that show empathy. Sanskruti, I have a question. If a patient's come for a follow-up visit, do we have to introduce ourselves, or can we say hello? Thanks for coming again. Yeah, so if it's a follow-up visit, then and the patient already recognizes you, you've already had that communication with the patient, then you could, of course, say hello. You would still say hello on a follow-up visit. But yeah, it wouldn't be necessary to reintroduce yourself if you already have met the patient previously. So we should always bear in mind the context of the interaction and make sure that what we're doing is logical. Okay. So challenges with the OET. Time management, says Shinu. Yeah, absolutely. That can be difficult. Do bear in mind that if you don't complete all of the tasks in 5 minutes, you won't necessarily be punished for that. The question is, have you focused on relevant information during the interaction? So there will be occasions when you're doing the role play where you're not able to cover everything in 5 minutes. Don't automatically think that is a problem, because it isn't necessarily. It will depend, as I said, on the quality and the relevance of the information that you've provided. So Taman, if the topic is completely unknown, what should we do? So there, of course, will be information on the role card to give you guidance, and that information is designed to give you enough to speak about so that you're able to provide useful information to the patient. So use your preparation time carefully if you have a topic that you're less familiar with. And during that preparation time, you can look at the tasks that you need to complete. And it is essentially an English test, first and foremost. The criteria are based on your fluency and your ability to communicate. So even if you're not so familiar with the actual information on the role play card, showing that you have a high level of English is still possible, even if you're not an expert in the topic. I know, because I've done I'm not an expert in medical, in a medical situation, and it's still possible for me to be able to speak for 5 minutes using these role play cards if I'm playing the role of a doctor or nurse. So make sure that you show your linguistic quality, even if you're not as familiar as you would like to be with the medical information. Srinath, please say how to start the conversation. Yeah, so again, this will depend on the situation. Similar to a comment from another student, there will be situations in which it's appropriate to introduce yourself if this is the first time you're meeting a patient and the patient is coming to your clinic, for example. If it's a situation where you're providing a home visit, if it's in a nursing context, then it would make sense for you to ask the patient if it's okay to enter their premises. If it's a situation where it's a follow-up visit, then obviously you won't need to introduce yourself. It'll just be a greeting. Generally, it's a good idea at the beginning of a conversation to ask how the patient has been feeling. This is a good way to show empathy, and it's a good way to begin rapport with the patient. Okay, so is this class for doctors or nurses? It's for both, Marius. We're going to do a doctor's role play and a nurse's role play together. What if the patient is a teenager, says Shahzad? Then you should treat them in the same way. So if the patient is too young to be able to communicate with you, then it will be a situation where you're talking to a carer. And if you're talking to a carer, then obviously you would address the concerns to that carer. But if you do have a patient who is a teenager, but they're old enough to be able to talk to you as a medical professional, then treat them in pretty much the same way as you would treat an adult. Just obviously use first names. You wouldn't have to say sort of Mr. A teenager would certainly expect you to use their first name. Aside from that, it would be pretty much the same. Okay, so yeah, so we all have challenges then, beginning the role play, maintaining fluency. These are the sorts of things that can be challenging, showing empathy. So we'll look at elements of this as we do our practice going forward. Okay. So there are two sets of scoring criteria, which I have briefly mentioned. Just remind me what the scoring criteria are for the role play. If we can remember. Just as I'm waiting for you to provide that information, Mary's asked, should I ask the patient name in emergency setting during preparation? Absolutely, during preparation, you can ask the name that you should use to address the patient with, because that's preparation. So yeah, I mean, you will be conducting a 5-minute role play with the individual, so it's good to have a name to use. So I would certainly recommend that during the 3 minutes preparation time you'll have before speaking, that you ask the name that you should use to address the patient or the carer. Okay, so the criteria then. So fluency is okay. That's one of the criteria. Yeah. But yes, as Shadin says, it's linguistic criteria and communication criteria. And Shahzad says the same as well. So those are the two criteria upon which you will be graded. When it comes to linguistic criteria, some of you are mentioning them already. We have intelligibility, fluency, appropriateness of language, and resources of grammar and expression. So you'll be graded out of 6 for each of these criteria. And you can see here a description of each of them. So intelligibility is looking at your pronunciation, intonation, clarity of accent. So it doesn't matter what accent you've got, but what does matter is, does your accent make your speaking less clear? Okay, hopefully it doesn't. So intelligibility, is the examiner able to clearly understand what you're saying? Fluency is obviously the speed and smoothness of speech. So this involves minimal hesitation or using hesitation effectively. So not hesitating because you can't think of a word, but providing pausing to allow the patient to process information. Appropriateness of language. So you should be professional, obviously, throughout, but also friendly, and providing an environment in which the patient in the role play situation will feel comfortable talking to you. And resources of grammar and expression relates to your grammatical accuracy and your vocabulary choice as well. The clinical communication criteria, you can see there are 5 of these. These are graded out of 3 each. So you have relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. So one thing that you should always do at the beginning of the role play is to ask open questions. Ask open questions in order to gather information about your patient, and by doing that, you will be able to provide appropriate support to the patient as the role play progresses. So don't forget to do that at the beginning. Ask open questions, find out about the patient's experiences, find out how the patient is feeling, find out what the patient knows about their current situation. And once you've asked those key questions, you can then move on to provide relevant support and information as the role play progresses. So these are some really important questions to ask yourself in relation to the criteria. For the linguistic criteria, did the speaker speak clearly and was the speaker easy to understand? Obviously, that's intelligibility. Did they vary their pronunciation and intonation in an appropriate manner? So again, that's intelligibility. So intonation, if you're asking a question, so you indicate that using your intonation. So, so how are you feeling at the moment? You can see that. How are you feeling at the moment? Sort of fall in intonation at the end. It's an open question to invite the patient to give more information. If it's a closed question, do you have any other questions? Often we have with a closed question, we have a rising intonation at the end. So do you have any other questions? Does that make sense? So with a closed question, we tend to have a rising intonation, and using intonation appropriately would be a way of communicating effectively. Another question to ask yourself, did the speaker speak fluently and smoothly with few hesitations and false starts? So obviously that's fluency. Did the speaker use appropriate language and tone? That's for appropriacy of language. And did they use relevant and correct vocabulary and grammatical structures? So there's your resources of grammar and expression. And when it comes to the clinical communication criteria, then there are 4 key questions we can ask. The first one, did the speaker speak in a way that offered empathy and support? Did they listen to the patient and respond effectively and appropriately? Was the delivery of information structured effectively? So with structure, it needs to be such where the patient is easily able to follow the information. So using sequencing language such as first, following that, once that is completed, and also using pausing effectively as well to allow the listener to follow each stage of the information that you provide. And then a final question, was the patient satisfied with your delivery of information? So we can pick up on patient cues. We should be looking at the patient for any expression of confusion or uncertainty. We should be checking, clarifying that the patient has understood, and offering the patient opportunities to ask further questions if there is any uncertainty. Okay. Good evening, Madhu. See, Madhu is joining us. Okay, so just for those that are experiencing any blurring, please do try to maximize the image on your screen, and hopefully that should address that situation. So Mary asks, is it okay if I address the patient as sir or madame? You can address the patient as sir or madame. However, it would be more expected that you would either use the first name, or you could use sort of Mr. or Mrs. and then the surname. The best thing to do, as I say, is just to ask the interlocutor, ask the examiner during the preparation time how they should be addressed, and whatever they tell you, just address them using that name. Okay. But obviously, if you forget the name, then we can use sir or madame instead. But it is quite formal. So the best thing to do is say, just ask the name of the interlocutor, write the name down on your role play card, and then you can use that as you are talking to the patient during the exam. Okay, so here is our first role play card. We're going to do our first role play practice now, and we can see this is a nursing role play card. So for those who are watching who are nurses, who have their exams coming up soon, or who just want to do some practice, get some feedback on their speaking, please let me know in the chat box. What I will be doing now is I'll be sharing the invitation link in the chat box. So if you would like to participate and do some nursing practice, just to emphasize, this is nursing. We'll be doing the doctors to follow up. Then let me know. Just click on the invitation link and you'll be able to join inside the class. So I'm going to send the link now. In the chat box. Okay, so let's see who wants to do some speaking practice. So all you have to do is click on the link and you will be able to join live inside of the class. Let's just see, we've got a few of the comments here. Cool Vans, if you haven't covered all the tasks as you run out of time, will this be a failure? No. As I was saying before, if you don't cover all of the tasks, that doesn't necessarily mean that you have failed, as long as the information that you do provide during the interaction is relevant and appropriate, then you will not be in a situation where you will have failed the task. Sometimes we do run out of time, and that won't necessarily impact your score negatively. Okay, so I can see we have been joined in the class. Jeslyn has joined us in the class. Oh, she had done, but she seems to have disappeared. Okay, we've also got a student that's joined us in the class. However, the devices are not connected. So if you are joining in the class, please make sure your devices are connected so that I can bring you in and we can do some practice together. So I'm resharing the link. I'm getting comments from some of you that you're not able to see it. So I've just reshared it now. Okay, under AT Lindsay. So, yep, just click on that link, and you should be able to join the class. Okay, so I can see that Eva has joined us in the class. So Eva, I'm going to bring you into the class so that we can do some practice together. Hi.
Yes, hello.
Hi, how are you, Eva?
Oh, thank you. I'm very good. How are you?
I'm doing well, thanks. I'm doing well. Where are you based at the moment?
Oh, I'm from Poland. I'm in Poland.
Okay, wonderful, wonderful. And when do you have your exam coming up?
Oh, in 3 weeks.
So very soon. Best of luck with the exam, Eva.
Thank you very much.
No worries. So could you let me know what your plans are if you're successful, assuming that you are successful in the exam?
I would like to try to work in UK or in Malta.
Okay, nice. Nice to have options.
Yes. I hope I will pass OET first of all.
Yeah, this will be the first time that you've done it, will it?
Yes, first time.
Okay, brilliant. Yeah, well, definitely, Eva, best of luck to you. Okay, so can you see the role play card on your screen?
Yes, I can see.
Fantastic. Okay, so you're going to have 3 minutes, Eva, to prepare for the role play. If you feel that you are ready to start before then, just let me know. But yeah, but you'll have up to 3 minutes. For those who are watching the role play at the moment, yeah, this one is for nurses. We're going to do another role play afterwards, which will be for doctors. I encourage those who are watching the class live to read the role play card carefully as well, and to make some notes. Think about how you would approach this task if you were doing this in the exam. So, okay, Eva, so you have 3 minutes to prepare the role play. Best of luck.
Thank you. How would you like to be referred as?
So you can call me Alex.
Alex, okay.
Yeah.
I think I can try now.
Okay, perfect. So you're ready to begin, are you?
Yes.
Okay. Okay. So yeah, if you'd like to begin the role play, Eva.
Hello, Alex. My name is Eva. I'm one of the nurses working at your GP. I'm here to discuss your recent blood sugar levels. First of all, how do you feel today?
Yeah, I feel okay. I don't feel too bad, thank you.
Oh, that's great. That's very good to hear that.
Mm.
Back to the topic. I came here to talk about your blood sugar levels, and recently they've been quite high. That's why doctor decided to commence an insulin injection. What do you think about that?
Well, to be honest, I'm a bit concerned about it because I've been managing my diabetes pretty well so far, without the need of any injections. So I don't understand why suddenly now it's necessary for me to start having these injections. I'm not very comfortable with it, to be honest.
Yes, yes. That's very understandable, and that's often the question in this case. But with time, sometimes the medication, your body become tolerant to the medication, and therefore you become. The medication become not effective as they used to be. That's why the next step is to proceed with insulin injection. I know it must be quite stressful and quite a new thing, but I can reassure you that you will be able to do it yourself, and it's pretty straightforward procedure. What do you think about that?
Well, so you're saying that basically the previous way that I was managing it, just with my diet and my tablets, you're saying that that's just not going to work anymore.
Not exactly that it won't work anymore. It's just because with time it's working less. We want to
Okay.
prevent for the side effect of diabetes to occur, and that's why we want you to have the best care here, and the best option right now would be start with this insulin injection. If you let me, I can explain you how to manage the injection. What do you
Okay.
think?
Yeah, because I don't really know anything about it. So yeah, it'll be good to know what I'm supposed to be doing. Yeah.
Yes, so it's very straightforward procedure, and I'm sure that you will be able to do it easily. I'm here. I have with me an insulin pen to show you, and I will try to explain how to do it. So first, you will be commenced with a special dose that doctor will tell you what dose it will be, and the hours of and the hours that you will administrate this dose. And you just need to find a place on your arm or on your thigh, pinch the skin, and uncover the lid of the pen, and press this big red button after injection, which say press. That will be it. That you will be able to do your injection. How do you feel? Is it a little bit clear now?
Yeah, I don't know. I don't feel that confident about being able to do it by myself. I'm just a bit worried that I'll make a mistake. I'll get something wrong. Yeah, I'm just a bit anxious still
Yes, I
about doing
understand.
it. Yeah.
Yeah, every time dealing with this pen and needles, it might be quite stressful. But look how small this needle is. You will barely feel the injection. It's almost like a mosquito bite. It's really it's really. I can reassure it's not painful at all.
Okay.
And also, we will provide you with a special safe disposable boxes for these needles, with the pack of the needles that you can, of course, replace all the time after every use. Um, and I'm sure you will be able to do it yourself. Is it, how do you feel right now? Is it any clearer now?
I mean, kind of. But yeah, I think I need to kind of get used to it.
Yes, definitely. Always beginning might be quite stressful, but I'm here to explain everything to you, and I will of course repeat that few times if you want. If something is unclear, feel free to ask right now. We can practice once again how to administer it. What do you think?
Okay, I'll just stop you there, Eva, just because we've run out of time. But yeah, absolutely. That was a really nice example of the role play. Shadin particularly enjoyed it. She's doing amazing, is what he was saying. So yeah, there are definitely lots of positive things in there, Eva. So your intelligibility is of a very high level, very clear. You speak also a nice fluent pace too. There was never any issues in terms of me following the information that you were providing, which was great. In terms of empathy, you have an empathetic manner. You said it's very understandable when I talked about being anxious about applying the medication, the injections, and you were asking me questions to get my consent throughout the discussion as well, in terms of explaining the procedure, and you were reassuring and also persuasive in terms of encouraging me that I will be able to administer this by myself. So yeah, so lots of positive stuff. You're saying it's very straightforward. You'll be able to do it easily, and this was obviously very appropriate language to use. You also, yeah, no worries. You also were focused on the tasks, which was great to see as well. Like each of the tasks you addressed clearly. You explained why insulin was needed. You went through the process, obviously provided reassurance, and at the end as well, you emphasized the need to dispose of the needles appropriately. So yeah, so lots of positive stuff in there. I think in terms of how we could have been even clearer, I think with the procedure, using sequencing language is really useful here. So by that I mean, so the first step is, after that you just need to, once you've done that, do this, and finally do that. So basically just using those stages to make it really clear how many stages there are involved in the procedure, 1, 2, 3, 4, however many stages there are, just using a clear marker to show each stage. And then also a summary as well would have been useful, I think, here, because you provided the stages and you explained it in language that was quite simple, but because the patient was quite anxious, maybe they just needed that repetition just to make it really clear for them. So yeah, just a sort of, a summary. Once you'd said it, you could have provided that just at the end if time were available, or, when the patient said, well, I'm still not sure, just a real sort of clear summary of the main points. Don't be afraid to repeat yourself sometimes in the role play, because if it's effective in terms of communication, then it will be something that is seen positively within the context of the role play. So I think that would have been something that would have helped, just to help to support the patient's understanding. Yeah, in terms of resources of grammar and expression, generally it was appropriate, but just be careful a little bit. So the word thigh, you were saying to put it sort of a pinch, you could put it in your arm, or I think you said tie, so just be careful, it's thigh, because that might have been the only words that that might have been unclear. Also you said, you'll be able to administrate, but you'll be able to administer in this case. Yeah, so just a couple of slips, but and also you said the medication become not effective as it used to be. So just with the comparative form, so the medication has become less effective than it used to be. Yeah, less effective than as a comparative. But yeah, lots of positive things in there, Eva. Like I said, particularly the fluency and your general manner. You communicate in a very calm empathetic way. So yeah, really good luck going towards the exam, and lots of positive things to focus on.
Thank you very much.
No worries, Eva. Thank you, and well done for getting involved.
Thank you.
Cheers. Okay, thank you very much to Eva there. Lots of positive examples of what we should be doing in the role play. And so, yeah, and thank you for your comments as well, just to have a look at some of the comments. Signposting was something that came up. I think, yeah, particularly signposting with sort of using sequencing language would have been appropriate. George, she is perfect. Very positive from George. Very good and clear, says Shahzad. Definitely, she was very clear. Gerald, I think she was supposed to start with an outline of the discussion. Otherwise, she was doing well. Well, she did start nicely, didn't she? You know, with empathy, asking how I was feeling, and she did give a general statement in terms of what her purpose was going to be in the role play. So I thought she did have a good start to the role play. Okay, and Kulvan says, well done, Eva. Roxana also, well done. Aram, she wants to assure the benefits of diet control. And Judith thought she did a nice job as well. I like her accent very much, says Azifa. I think I'm going to copy it. Okay, so let's move on now to the doctor's role play, which we'll be doing very, very soon. But these were the questions to ask, weren't they? Linguistic criteria and clinical communication criteria. These are the ways to assess the success of the role play. And I think we can say, did the speaker speak clearly, and was the speaker easy to understand? Yes. Did they vary their pronunciation and intonation relevantly? Yeah, there were examples of that. Did the speaker speak fluently and smoothly with few hesitations and full starts? Definitely. Did the speaker use appropriate language and tone throughout? Yep, we can say yes to that. Did they use relevant and correct vocabulary and grammatical structures? I pointed out some slips, some mistakes there, but generally she did. Did the speaker speak in a way that offered empathy and support? I think we can say yes, she did. Did they listen to the patient, respond effectively and appropriately? So I thought, yeah, we could have repeated information or paraphrased, used sequencing language there. That could have been an improvement in that area. Was the delivery of information structured appropriately? Again, that's where the sequencing comes in. And was the patient, and also possibly summarizing as well, was the patient satisfied with your delivery of information? And again, I think that's where the summarizing would have helped there. So linguistic criteria, really strong. Clinical communication criteria, some positives, some areas as well where we could have been even clearer. So remember, if you are watching live, there's 20% off selected OET courses. If you have your exam coming up very soon, take advantage of this. This will be an offer that will expire within 24 hours. So do take advantage of this situation whilst the offer still exists. Okay. So let's move forward. If you want to find out more about this offer, I should say, then do click on the link www.swooshenglish.com or click on the links in the chat box, which are being shared now. And just to emphasize, the offer ends today, so do hurry to take advantage. So we're looking now at the medicine role play. So if you are a doctor, then do click on the link to join the class. I'm going to share the link again, so that you have the opportunity to join if you are a doctor. This is the doctor's role play that we are doing now. So please only join the class if you are a doctor. Okay, and if you have joined the class, just let me know in the chat that you are a doctor, just to make sure that I am selecting an appropriate speaker. Okay, so Cool Vans has a question. During the speaking test, is it necessary to keep a steady eye contact with the interlocutor patient? Is it acceptable if you glance at the task card time to time? Yes, of course it's acceptable. So generally you want to maintain appropriate eye contact with the speaker because that helps to build rapport and empathy. You know, if you're not making eye contact, then this can be something which could be quite uncomfortable for the patient. But yeah, of course, you can look at your task card from time to time, no problem at all. You should be making notes on the task card, so looking at it will help you to communicate more effectively. Okay, so great. So we've had some doctors now that have joined us in the class. So I'm going to bring a doctor in to do some practice with us. Just let me know in the chat box if you have your exam coming up very soon as well. But yeah, I'm going to bring a doctor in. So 28th of August. Ooh, that is very soon. Okay. Okay. I should have said this before actually with the nurses, but with the doctors, I will say it now. If you could access your camera for this, that would be brilliant. Just because actually we can then look at things such as facial language as well, which is very useful when it comes to the role play. So if you can access your camera, that would be wonderful. Okay, so I'm just going to bring a doctor into the class now. Okay, so Tarindu, is that correct pronunciation? Hi, how are you doing?
Hi, I'm doing good. I'm a little bit off today.
A little bit off?
Yeah.
In what sense?
I'm out of work today, ma'am.
Yeah. Good. You got some time off. You got some time off. That's
yes,
good news.
Yes.
So Tarindu, which country are you working in at the moment?
Yeah, I'm from Sri Lanka.
Okay.
I'm working in Colombo. Yeah.
Wonderful. And when do you have your exam? Do you have your exam coming up soon?
Well, actually, I haven't booked my exam yet, but I'm doing my preparation beforehand.
Okay, yeah, very sensible. Brilliant. Okay, so can you see the medicine roll card on your screen?
Yes, I can see it.
Brilliant. Okay, so you've got up to 3 minutes then, Taninda, to prepare your response to the roll card.
Okay.
If you're ready before then, just let me know. Otherwise, we will start in 3 minutes. Okay.
Sure.
Okay.
Well, according to this, the emergency situation happened a few days back now. The Matthew was brought by his parent for review, it seems, right? Hello? Can you hear me?
Hi there. Sorry, Tarindu. Yeah,
Yeah.
that's correct. Yeah. This is going to be a follow-up. Yeah.
Yeah. Okay. Okay, I'm ready to start, Alex.
Okay, brilliant. So,
Yeah.
okay, so
Yeah. Hello, Alex. I can see your son today. How is he doing now?
well, to be honest, I'm pretty concerned. So he's had, obviously I had to take him in
Yeah.
before, to the emergency department, and but yeah, he's still for like the last month he's just been coughing. He's not been breathing properly. And it's a situation where he's had fever. Yeah, I'm just really worried about him.
Yeah, I can totally understand you. Yeah, it's like I mean, having an acute asthma attack, it's really a horrible thing for a patient. And I mean, so now you had experienced that, and then after that you Matthew had several symptoms of asthma. So
Yeah.
can you tell me what have you learned about asthma since the hospitalization?
I don't really know much about it at all, to be honest. I mean, obviously
Yeah.
I've heard of the term, but I don't really understand exactly what it involves.
Actually, yeah. Sorry to disturb you, Alex. Just please continue. Yeah.
Yeah, well, no, that's it. Yeah, and also, I want to know, will he always have this condition? Is it something he'll have for the rest of his life?
No, actually, Alex, the asthma is it's a really common thing, mainly during childhood. So most of the kids have asthma, and actually, that the pathology is like this: that kids' upper airway it gets narrowed, and there's inflammation, and it responds abruptly to certain substances. So he'll get wheezing, shortness of breath, and sometimes cough at night. So that kind of situation he has to face time to time. But even with that, if you follow the medication properly, he'll be able to get rid of it quickly.
Okay, so he'll be able to overcome the asthma.
Yeah, actually it's a treatable condition, but the problem is that triggering factors, as much as possible he needs to avoid trigger factors like sometimes the dust and even pollen and even fumes from the smoke, I mean the fuel smoke, or even some dust mites in household can trigger that. So it's better to keep your environment clean as much as possible, especially the kids' bedroom and surrounding inside the home mainly. And is there anything you want to know about this managing part? I mean,
Well, I mean, I understand that. To be honest, I'm particularly worried that Matthew might have a severe attack, and so So what could I do in that situation?
Yeah, actually, it's could be some kind of horrible situation. But first thing is, do not panic. So you have been given probably. Actually, I can see the notes. You have been given you had given Ventolin and some other steroid inhaler. So best thing is try to give four puffs of Ventolin straight away. And if it's not responding, you can repeat that. And with that, even if he's not responding, it's better to get him to the ER, and the people in the ER will arrange nebulization, so it'll reduce the response. As I said before, if you're keeping the child free of triggering factors, then follow the inhaler properly, then you will be able to he will be able to get rid of his symptoms.
Okay.
Yeah.
Okay.
Is there anything you want?
Well, apart from that, I just wondered, like, is there anything else that you can do to help me with this situation?
Oh, well, and he's 5-year-old, so he must be schooling, so that his class teacher should be informed about his condition, and inhaler, there should be an inhaler available with the classroom. If you could provide with the class teacher, if there's emergency, so she can use that as well. So you do not need to be worried about that. If he get the attack at school, it can be managed, and they will inform you, because they know about the child's condition. So I don't think that much problem with schooling.
Okay, that's great. I'll just stop it there, Tandera, just because we've run out of time. But
Okay, sure.
here we go. Good stuff. Okay.
Yeah. Anxious. It's my first role play, actually.
Is it? Is it the first time you've done it? Okay.
Yeah.
Well, you seem very calm to say it was the first time that you've done it. So, yeah, that was good. I mean, so it was a nice beginning at the start. It was appropriate. It was nice you were using the name of the patient's child as well, or the carer's child. That was a nice touch. It shows sort of relationship building. Also, I like the fact at the beginning as well that you were showing that you were listening actively. So, just like that's good, because it shows that you're listening to the patient. You're using those kind of listening expressions, and then you apologize for interrupting and encourage the patient to continue contributing, which I also thought was a good thing to do, because at the beginning it's important to hear from the carer or the patient, and then obviously as the role play progresses, it's going to be more based on the information and the guidance that you will provide. So it was some good strategies that were being used at the start. What I would say though is just be careful with some of the language you're using. So you said the pathology is, which would be, that's not really layman's term. It's not a term that most people would follow. It's quite a medical term. And then you also said that if there is an attack, this was towards the end of the role play, you said the child would be provided with nebulization, which again is not a very common term. So in terms of appropriateness of language, that could be a bit confusing. So yeah, just think about, okay, what terms am I going to use to make sure that the carer or the patient is able to follow what I'm saying? And if you do use a term that might be less common, explain it to ensure that there isn't going to be any confusion there. So yeah, but generally speaking, your fluency was at a good level. There's certain moments of hesitation, but it wasn't extended hesitation. I think that was more maybe, like you said, just a little bit of nerves, which is natural, but it wasn't extended hesitation. There was an attempt as well to provide reassurance and empathy. Just be careful with some of the wording that you use, though, because you said it could be a horrible situation. So horrible is a very, it's quite a dramatic term to use. So maybe difficult, challenging situation or a worrying situation. I think, as obviously as a doctor, if you're saying that something could be horrible, then the patient is going to magnify that even more. So it's good that you're using that language, but just be careful with the adjectives that you use. And at one point as well, you said, don't panic. It's always better, rather than giving kind of like negative instructions, it's always better to give more positive. So try to remain calm would always be more, I think, effective than sort of don't panic. Because again, if you hear the word panic, even though you're saying don't panic, just hearing the word sometimes can make the person panic. So yeah, I think that's what I would say. So you're using good strategies. It's just the expressions that you're using, which I think could be a little more, let's say, a bit more neutral. Then I think they'll be more effective. But yeah, lots of positive things. That your intonation and your pronunciation is very clear throughout, and your resource of the grammar expression as well are of a high level. So definitely lots of positive things there, Tandera.
Yeah. Thank you very much. Thank you.
No worries. Thanks for getting involved. Okay. So just a few comments here. So Marius, 2 questions. What should I wear on the test day? Is there a specific outfit? No specific outfit. Just obviously just appropriate clothing depending on the weather. Just doesn't have to be too formal. So don't worry so much about, there's no particular outfit you need to wear. And depending on the country you're in, you know, maybe in certain countries they might specify. So just when you book at the test center, do have a look to see if they do give any specific advice on that. Do I have to wear a face mask at the venue in the UK? It's likely that you will, although in most places in the UK now, face masks are optional. Again, do make sure you have a look at the website for that. Depending on the test center, there could be different guidelines. Sanskriti, in the terms of feedback, use layman's terms. Can't use the word horrible. Yeah. But yeah, also says for the first time doing the role play did very well. Absolutely agree with that, Sanskriti. And any other comments? No need to introduce to the patient. With it being a follow-up, you didn't have to provide an introduction necessarily, or it was a follow-up after an emergency consultation. So just a greeting would be fine in that situation. So can I assume I'm a new doctor seeing him for the first time? Well, it says an emergency consultation when it was diagnosed with asthma. So we can assume took Matthew to the hospital emergency department where it's treated with nebulized salbutamol. Yeah, it could be either way, couldn't it? I think the way it's been expressed. So I think certainly an awareness of the fact that the patient has been diagnosed with asthma and an acknowledgement that this is a follow-up would be appropriate here. Okay. Okay, so again, the questions that we should be asking ourselves in relation to this, the linguistic and the clinical communication criteria, these are the key questions to ask. And the linguistic criteria generally were well achieved. As I said, there was some hesitation, but generally the language was clear. The issue here would have been obviously with appropriateness of language, as was pointed out in some of the medical terms that were used, which the speaker may not have been able to follow clearly. And with the clinical communication criteria, there was empathy, but some of the word choice was not appropriate. So that's something, of course, that we would want to address. So how do you pass first time if you're looking to do your OET speaking for the first time? Motivation is key. Obviously, finding the time to practice, having the right tools, and having that support and feedback in order to be able to develop as quickly and as effectively as possible. Do you have all of these? Here at Swoosh English, we can provide you with these tools. And for today only, there will be 20% off selected courses. So do take advantage of this 24-hour offer. Head over to www.swooshenglish.com in order to take advantage of this offer and to find out more information today. But do hurry because the offer expires by the end of today. So thank you very much to all of those who have watched this class live and to those who have participated. I do apologize, obviously, I'm only able to do 2 role plays within the time that we have, but we will be doing mock speaking practice again the same time next week. So if you would like to take part in that, either as a viewer or if you would like to do direct speaking in the class, then join us then, 9 AM BST, same time as this week. On the 27th of August, next Friday. Okay, so that brings us to the end of the session today. Thank you once again for your participation and all those who have been watching the class. I hope you found it useful, and I will see you again next week.